Hello, everyone, and welcome back to the Outcomes Rocket. So excited that you tuned in to another episode of our podcast because today I've got Amir Syed with us. He is the president of BRSi. They're doing some incredible work in the RCM space. It's an area that needs a lot of focus with a lot of the new technology that's going on around, causing problems for providers. And so Amir and his team are doing great work in the space to help overcome some of the challenges. Amir, welcome to the podcast. Really excited to spend some time with you today.
Thank you. Glad to be here.
Of course. Yeah, man. So look, just to get the audience warmed up on you and who you are, what inspires your work in healthcare?
So my sister and I actually, we are 1 year apart, and we both wanted to do work in healthcare just because we come from a family where there's a lot of clinicians. And so one of the things that I always struggled with, though, is I did not want to be a clinician, but we loved the healthcare industry. And so she went on to be a doctor, and I went on to study health administration. So I got my master's in health administration, telling her, of course, jokingly, that one day I would employ her. And so we have a little bit of a competition going on. But I love the intersection of health and business and recognizing how complicated, obviously, delivery of care is, especially here in the U.S. And I think just being able to actually help solve that problem is a blessing for me, and it's very meaningful. I'm very passionate about simplifying patient care, the financials that go with it, and rev cycle naturally a great fit and something that I've harnessed a lot of my expertise around.
That's great, Amir. Well, I love the sibling rivalry.
Right. There's a little bit of that going on. I got to acquire a hospital. I got to become the CEO of a hospital and then hire her as my physician. So that's still in the books.
That's you get that, and then you could retire. You're good.
That's right.
That's awesome. I love that. Yeah, I got a brother that's 2 years younger than I am, and we have a similar type of rivalry that makes us both better and the people around us better. So I think that's awesome. Yeah. What led your move to BRSi? Tell us about that.
Well, I was previously in management consulting, Grant Thornton and Guidehouse, partner there in the healthcare practice. I recognized at a certain point that obviously AI was having a big impact in healthcare. And when I looked at what BRSi did as a company, I realized that they were at the intersection of both product as well as services in the healthcare market, particularly around revenue cycle. And that meant a lot to me, especially where the field is going and where a lot of people are struggling right now with what to invest in. A lot of providers are struggling with, like, where do I invest given AI? Do I outsource revenue cycle? Do I keep it in-house? Do I just get my staff trained on a new product versus do I just outsource the whole thing? So I think for me, joining a product company that also sells services in addition to the product was just a good move to help shape what we're trying to go in the future, healthcare, RCM.
That's great, Amir. Yeah, it's like the build by partner question. And then it's like product will only take you so far. Services will take you the last mile. That's you found the sweet spot with BRSi. Yeah. That's awesome. That's awesome. Yeah. Well, congratulations on the move. So for the folks that aren't familiar, and I know last year, actually, we had the chance to have Natalie from your team on the podcast, so they got a little glimpse. But for those that are not familiar, what does BRSi do to add value to the healthcare ecosystem?
So BRSi, and this is a little bit unique, I think, considering all the new players in the healthcare RCM space, is BRSi has been around 33 plus years. So early 90s, they've been working on the back end with patient collections. They went on to build out, at the time, an automated solution to help large healthcare systems bill and collect from third-party payers. And that product is called ARMS Pro. Mm-hmm. That product has continuously been matured over several years to the point where the Department of Defense actually acquired it. It's called Abacus in that environment, for those of you in the audience who are familiar with Abacus. And then BRSi went on to build other tools and solutions, including front-end insurance identification, electronic insurance identification tools, as well as back-end denials management tools that include predictive analytics and denials workflow tools to help with remediating denials. And so as BRSi evolved, the market has shifted from hospitals and providers paying for just the software and wanting you to actually have your own staff work the denials and do the things that need to be done in addition to the software. So BRSi has done a really nice and remarkable job hiring talented RCM staff to supplement the software that they brought to the market. And so now that's what we do. We offer not just the software, but we offer the staff with the software to help a lot of healthcare systems tackle their RCM issues. So
That's great.
It's been fun.
That's awesome. And so what are you seeing right now? There's a lot of challenges. You hear a lot about prior authorization, payers using AI to deny claims. Like, what are the biggest revenue cycle challenges that providers face today?
Yeah, well, you hit it right there with, first of all, payers using AI to automatically reject claims that don't have certain parameters. I think traditionally payers have had more margin than providers, so they are able to invest a lot earlier and a lot faster than a lot of hospitals and other systems have. And so the denial just came in fast and furious, I think, for a lot of healthcare systems across the country. And I think it was a wake-up call for a lot of CFOs in particular to really start moving money to invest in AI to help not just protect their revenue, but accelerate their cash as they see more patients and more complex cases. So in my view, the RCM challenges are twofold. One is for providers to understand what companies are out there and what they're doing with respect to AI, which ones they can trust versus which ones are high risk propositions. I think that in itself can be problematic. I know I've had hospital CFOs and others reach out to me for just advice on what they want to do in terms of their own investments. And one thing I say consistently is that you have to make sure as you engage with an AI company that they have previous RCM experience. I think that it's a challenge for companies that do not have RCM experience, that have really good AI tools to come in and just start piloting and then start building out their AI solution on a hospital's dime, basically. And I think that's a risk. And I think hospitals and healthcare entities in general should be very wary of doing that. The second thing is the front end of revenue cycle, which is just prior auth, patient registration, getting information right the first time. I think that a lot of denials on the back end and other things are related, historically have been related to the middle and the front of the revenue cycle. We've seen payers use AI to reject claims that they know the providers have already made mistakes on the front end. So I would tell providers, look at your ROI, look at your front end, clean up at least your front end to begin with, all the clerical errors, things of that nature, patient, just insurance identification. These are quick and easy fixes.
Yeah.
It'll prevent you from having to deal with these AI bots on the back end from the payers rejecting your claims immediately.
I think that's well said, Amir. And to your point, there's a lot of new entrants into the market that don't really get the nuances of RCM. And it's like somebody told me once, a mentor of mine said, hey, look, money, like let's talk about technology, let's talk about money. Money amplifies who you are as a business or as a person. So if you're a jerk, money will make you a bigger jerk. If you're great, it'll make you even greater. Technology does the same thing, right? Like if you put technology on process and lack of knowledge, it accelerates mistakes.
Yeah, that's right. And it's a challenge right now because a lot of hospitals are starting to recognize that they need to simplify and streamline, but then they run into another problem, which is that these EHRs like Cerner and Epic, great EHRs, they know how to create a medical record, they know how to get dictation notes in there quickly, effectively, but just because you're great at building out an EHR doesn't mean you're great at handling a revenue cycle patient accounting system. And so that's one thing I would caution is that
Interesting.
especially speaking to the audience, you think about if you're working in a large healthcare organization and you're like, I need to simplify and streamline, let's get rid of all these other, well, do that to the extent where you're carefully thinking about what companies are good at what. And so if you have an EHR company that's great at building out your EHR, great. But that doesn't necessarily mean just because they sell a patient accounting system or rev cycle or denials management system, that needs to be bought just to have one system as opposed to having one that integrates effectively but does it so much better.
That's so well said. So well said, Amir. Just because they sell it doesn't mean they're good at it.
And they sell the streamlining. They're like, simplify and streamline, just use our system for everything. Well, okay, but what if your system's not great at everything? So then you have to juxtapose, where do you go? And I think a lot of hospital executives have to think through that before they make those investments.
That's well said, because the EHR companies are working to capture share as well, right? Like they want your business. Doesn't mean they're doing the best job at it. So definitely a stone you may want to turn on that one, folks. So what should health leaders be paying attention to over the next 12 to 24 months, Amir?
So I think that, as we hit on, the advancements in AI are pretty cool in terms of what it does and how it does it. They need to start thinking about how to, instead of focusing on selecting vendors and doing all that, is actually fixing processes first. And so what I say is, look at the way you conduct your business. Really step back and look at it. Revenue cycle has been pretty consistent, to be honest, in the last 20, 30 years in terms of the way a patient goes through the system, the way the patient is billed. And AI has come in and really started to shape that, right? It shaped the foundations of like, how should I be collecting insurance? Should I be automating that entire function? How should people be documenting encounters and putting it into the record? Should that be something that we're using autonomous coding to do? All of that is touching your RCM in ways that will impact your receivables. So what I say is, without even thinking about your AI and what you're investing in, start looking at your business processes, your clinical processes, and just make sure that it is what it needs to be in terms of intersection dependencies, taking out the clutter. And then once you have that cleaned up, then look at, okay, what investments should I make in tech that will enable us to work faster, smarter? I think too often, and it's probably because there are great pitches out there, a lot of hospital execs are looking at AI first, all these pitches, and saying, okay, let's do that. Let's pitch this to our staff and just hope that they can just get on the bandwagon. And so that's one thing is I say, work on streamlining, simplifying, fixing your business processes, your clinical processes first before you invest in AI. Then on the flip side, you have to remember that denials management is becoming a big deal, as we mentioned earlier. Don't just go remediating all of them without thinking about the big picture in terms of what are my trend lines. Predictive analytics is huge in denials management now. And if you're not already thinking about it, I do suggest you think about how to prevent denials using new, really good, savvy predictive analytics around preventing denials in the first place where there are problems so that you're not having to deal with it on the back end through workflows and other tools. I think immediately in the next 12 to 24 months, both of those things are critical to just making sure that you stay ahead of what your competition is doing.
That's awesome. Yeah, take a look at your processes and predictive analytics, tighten those things up. You're going to find gold underneath those rocks.
Yeah, right.
That's
right.
awesome.
I love the predictive analytics because you can literally look at the departments that you know are having problems just because maybe a certain payer has found that at your institution, this is a recurring issue that they can deny. And so they'll just keep denying it. And you keep responding to those denials with corrections instead of saying, wait a minute, I noticed I've had 50,000 of these rejections over the last 2 weeks. Let me go back and fix something in that department so that I'm not getting any more going forward.
That's awesome, man. Yeah, well, look, you guys are deep in the tech and the services. My understanding is you'll be at HIMSS as well. So, folks, surprise, I'm going to give you a little surprise. Amir and I are going to do a part 2 to this session. So if you've enjoyed today, stay tuned because we're going to do one live at HIMSS where you could learn more straight from the show floor where a lot of the latest innovations are happening as well as the innovations from BRSi. So, Amir, tell us a little bit more about what you guys will be doing there and then where the listeners could connect with you between now and the next time they hear from you.
Yeah, so we have our website, brsi.ai. go log on. We have a newsletter. Register for our newsletter. You'll see more about where we are, what we're doing. And then at HIMSS, that's right. We are at HIMSS, and we are actually exhibiting at HIMSS. So we will have a booth. Our booth number, for those of you listening, and if you have a paper and pen handy, it's 12129. So come visit us at 12129 BRSi booth. I tend to be very active on LinkedIn. And so if you want to follow me, connect with me on LinkedIn, I'm happy to share more insights into what we're doing and how we're going about addressing the problems in the market.
Outstanding. Well, there you have it, folks. An insightful session with Amir Syed. He's the president of BRSi. Check them out. They'll be at booth 12129 at HIMSS, where I'll be joining Amir again to do our live at HIMSS session. And we'll be sharing that with you straight from the show floor. So thank you all for tuning in. Amir, thanks for being with us.
Thank you. See you in Vegas.
See you there.